My name is Piper Christian, and today I will be presenting on HB 21 School and Child Care Center water testing requirements, sponsored by Representative Handy and Senator Iwamoto. Childhood lead exposure is a significant problem in the United States. In a study conducted by the Center for Disease Control and Prevention in 2015, it was found that as many as 500,000 US children, or 2.5% of children under the age of 6, have blood lead levels greater than or equal to 5 micrograms per deciliter. This is the threshold above which the CDC has determined that blood lead levels are unsafe. We will be closely exploring the issue of childhood lead exposure in this presentation. In this analysis, we will examine the prevalence of lead in US drinking water supplies, rates of testing for lead in school and water systems, health consequences of childhood lead exposure, and HB 21 as a policy intervention, examining the benefits, costs, alternatives, and limitations. While drinking water typically starts virtually lead-free, as it flows through lead pipes, passes over lead-soldered joints and lead-containing brass and bronze fixtures, or through corroding lead-bearing faucets, it may become contaminated. A study published in Environmental Health Perspectives found that from 2000 to 2004, 274 US utilities serving 11.5 million people reported unsafe levels of lead in their drinking water. Clearly, lead exposure through drinking water is a legitimate health threat. Despite this prevalence of lead contamination, the Government Accountability Office found in 2009, as a result of regulatory gaps, only 8 to 11% of the 132,500 schools in the US were required to regularly sample their taps for hazardous contaminants. You can see a depiction of this in the graph on the right. To date, all water quality testing programs in Utah schools have been voluntary, and many schools have been unwilling to test their water out of fear of incurring high costs to remediate the problem. In 2017, the Utah Department of Health conducted a pilot study in which 673 Utah schools were tested for lead in their drinking water. Of the schools tested, 22 schools were found to contain unsafe levels of lead in their drinking water. This suggests that there are likely more schools in the state that have unsafe levels of lead in their water that have not yet been tested. In 2021, the National Institute for Occupational Safety and Health listed the effects of short-term and long-term exposure to lead, which can be seen here. The short-term exposure impacts include abdominal pain, constipation, fatigue, headaches, loss of appetite, and irritability. And the long-term impacts include lower IQ scores, reduced brain development, heart disease, high blood pressure, and reduced fertility. In this infographic, we can see how HB 21 School and Child Care Center water testing requirements will be administered. Under HB 21, in Step 1, any public or private elementary school, secondary school, preschool, or kindergarten shall submit water to a state laboratory for free lead testing. In Step 2, if the tested water contains greater than 5 micrograms per deciliter of lead, which is considered an unsafe concentration in drinking water, the school will publicly report the results. In Step 3, schools will receive state funding to remediate the contamination within 30 days of finding unsafe levels of lead. This policy will provide a reliable mechanism to remediate lead contamination in school water systems. HB 21 does have a number of costs associated with it, but it will be fully funded by the American Rescue Plan Act, which are federal funding allocations. The funding includes $3,500,000 allocated to reimburse schools and child care centers to cover expenses of testing consumable taps for lead and to provide staff to coordinate sampling and remediation efforts, and $411,500 to provide reimbursements for the costs of remediating taps found above the action level for lead. In a study published in 2009 by Dr. Rebecca Renner in Environmental Health Perspectives, it was found that only 10 to 20% of children's lead exposure arises from drinking water. This is a significant limitation of this policy. Even if we clean up school lead drinking water, there's still going to be risk of childhood lead contamination. Alternative policy interventions include eliminating lead from airplane fuel and removing lead paint hazards in older homes. Unfortunately, it's much more technically complicated to remove lead paint in older homes, and it would take federal policy to create regulations to eliminate lead from airplane fuel. Therefore, removing lead from drinking water is the best state-level intervention for Utah that is both feasible and can be done quickly and affordably. In summary, HB 21 is a smart policy for Utah. It addresses the threat of lead contamination in school drinking water. It is federally funded and affordable for schools and childcare facilities. And it helps address a variety of childhood health risks, which we stated earlier. Finally, it's broadly endorsed by the Utah School Boards Association, the Utah Department of Environmental Quality, and Utah Physicians for a Healthy Environment, among others. It's been a pleasure researching this policy and issue over the course of this semester, and I believe that we should support this bill. This is demonstrated by the fact that it was approved by both the House and Senate in the past legislative session and passed. Thank you.